Fit, active, healthy, happy, enjoying the prime of your life. Looking out for your health and wellness, this is Health Talk with Fred Lowry from Lowry Drug in Statesville. Visit Fred at his store, conveniently located on Hartness Road in Statesville.
Good afternoon. This is Fred Lowry, pharmacist and doctor of natural medicine, and this is Health Talk. This episode was pre-recorded for July the 10th, 2026. We're here exploring the facets of your health and keeping you up to date and informed. This program is intended to share knowledge and information based on my research and experience. It's not intended to offer individual advice, nor does it replace a one-on-one relationship with a qualified healthcare professional. Your daily choices are yours and have more to do than anyone in the healthcare field. My hopes are that this show will empower you with knowledge to take a more proactive approach to your health. I have many sources here, and I'll mention them, try to mention them as I come along with this. So, last week we talked about estrogen and hormone replacement related to aging women and in menopause. But one of the concepts overall is that hormone replacement is considered anti-aging. I've mentioned before, I don't really like that term, but if we look at it around the frame of your health span as opposed to your lifespan, you know, the amount of time that you're healthy within your life and the concept of optimizing that as much as possible. So this falls in the realm of hormone optimization, nutrient optimization, for healthy longevity, and so you can have a longer life, but sometimes the quality of that may not be quite as good. So this has to do with hormone nutrient restoration, vitality care. It may be more of a personalized approach, and it emphasizes function over age and the continuity thereof. So one of the things about hormones, I think there's a lot of misunderstanding about hormones. Actually, there's a tremendous amount of misunderstanding about hormones, and I think a lot of people are afraid of them, and particularly from the physician model in many cases, not all. So hormones replacement in the past really has been symptom oriented. So it was used to take care of a symptom. It wasn't about life optimization, although the reduction of hot flashes, as an example, night sweats, certainly is a life quality improvement situation. But we have a lot of hormones that your body makes. You make these hormones from LDL cholesterol, and they start with pregnenolone, and there's progesterone, there's cortisol, estradiol, testosterone, DHEA, and all of these hormones are beneficial for both sexes. So one problem is we tend to think about a particular thing like testosterone as the male hormone. That is not completely correct. Women have testosterone. They need testosterone just like men, only in different levels. And the same thing is true with estradiol, the estrogen. Men have estrogen. Men have progesterone. And all of these hormones have specific things that they do. So one of the problems in medicine is we tend to categorize a particular drug or a substance as doing one thing, and we know that's not true. A great example of that is ivermectin, that we thought about as being antiparasitic, and now we know that it does have antiviral properties and also anti-cancer properties. So I think it's a mistake to think about, as an example, progesterone which the name comes from progestation. It's associated with women in the second half of their cycle and also in carrying a pregnancy to full term. But progesterone used for men has got this big question mark. Why would we do that? It doesn't make sense to us. But I would argue that progesterone is also important for men in many ways, and we're going to go over that. So these bioidentical hormones, meaning the same hormones that your body makes, impact energy, mood, cognition, sleep, sexual function, and metabolic health. And each hormone has its own unique purpose. They're not really interchangeable. And one great way to determine what you need is to do testing, such as a saliva test. So the big picture here is that from cholesterol, from LDL cholesterol, you make pregnenolone. And as a side comment, I would say that most everybody on a statin, particularly high-dose statins, should be on pregnenolone to help feed that steroid cascade downstream, if you will, because you're just not making enough, and that's where a lot of the side effects from the statin drugs happen. So pregnenolone, which actually you can get this over the counter in a capsule form, it is considered the mother hormone because all the other hormones are made from that, and it's the precursor to progesterone, DHEA, cortisol, and all the sex hormones. As an overview, DHEA is a downstream, actually adrenal hormone. Your adrenal system is your stress hormone system. It's the glands just above your kidney, and it does make that from pregnenolone, but it's also the precursor to male androgens like testosterone and estrogens. So, and then progesterone is another very popular prescription hormone replacement product, also made from pregnenolone. But one of the interesting things is it modulates the nervous system and contributes to overall balance of the hormone system. So in adding any of these, they can basically kind of push the balance. DHEA, made in the adrenal glands, is involved with energy, mood, libido, bone health, muscle maintenance, and stress response. And it's also a very effective hormone in a vaginal cream for vaginal symptoms associated with menopause. So a lot of common benefits with DHEA, supports androgen function with men, really good for women with sexual drives, and good for bone density and muscle tissue in older adults as they decline. Stay tuned for more health talk. This is Fred Lowry, Lowry Drug in Statesville. We're talking about hormone replacement and a way to think about it differently in terms that hormones are impactful for both sexes, maybe at different levels. But as we age, hormones diminish and our overall health diminishes as well. We keep in mind these hormones are chemical messengers. So we were talking about DHEA in terms of impact for men and women. So there's a lot of balance there that goes on. DHEA is also a hormone that can provide testosterone or estrogen for either sex. Really good in low dose amounts. That's a vaginal cream for dryness and pelvic health. So DHEA is available over the counter. Pregnenolone is also available over the counter. Of course, it's made from cholesterol, as I mentioned. It can be made in the adrenal gland. It's actually made in every cell of the body. And so the interesting thing is it acts as a neurosteroid, a brain steroid, that influences cognition and mood. So ability to have memory, focus, and the lack of brain fog. It's good to support stress for overall resilience and supporting adrenal function. It can reduce the symptoms of menopause and andropause, low testosterone. Potentially helps immune support, weight management, primarily by modulating cortisol. So this is something we're going to talk about relative to thyroid function and weight gain with men and women. SAH, big topic there right now. So mentioned before with pregnenolone and statins. So statins, lowering the cholesterol, can reduce pregnenolone and all the downstream hormones. So one clinical study showed that low pregnenolone levels are often seen in patients receiving statins and links these to memory impairment, low sex hormones, and possible dementia risk. That's a big deal. And so, in my opinion, individuals with statins individuals that have dementia are taking statins, that needs to be really looked at closely because I think that's a problem. So taking oral pregnenolone for these patients along with fish oil to help support brain function is really a good idea. And some of the things I talk about as part of the more popular functional medicine style approach, which basically looks at upstream drivers for symptoms instead of just treating them as such. Now, progesterone, one of my favorite hormones for use, particularly in women, it's a major sex hormone. It is important for the menstrual cycle regulation, pregnancy maintenance, and the balancing effects over estrogen. Keep in mind, excess estrogen causes weight gain. But beyond reproduction, and this is really important, it modulates GABA receptors in the brain, supporting calm sleep and anxiety control. So think about that. The GABA receptors, that's where all the anti-anxiety drugs, the clonazepam, alprazolam, diazepam, all of those drugs work on those GABA receptors. And progesterone can actually be a good thing related to that in place of those other drugs that have known problems and typically some addictive properties, and for some adults they just have a very difficult time getting off of those medications. And part of the reason for that is one of the speculative things is these drugs actually alter the receptors so other things don't work there as well. So when we're talking about progesterone, using bioidentical progesterone, of course, oral progesterone is helpful with sleep, anxiety, hot flashes, cycle regulation. It protects the endometrium when using estrogen, the tissue in the uterus. So oral can do that. Topical is also used in a cream form. So we're with this medication, we're reducing anxiety. It's good for your bone health. It may help reduce breast cancer risk relative to the balance of estrogen. So think about progesterone as balancing estrogen and balancing cortisol, which is really important. So how would progesterone be useful in men? And let me just back up just a little bit. With women, as they cycle, the first 2 weeks of the cycle is estrogen dominant. The last 2 weeks is progesterone dominant. If a woman conceives, the progesterone stays high. If they don't, then the progesterone drops off, and then the cycle starts. And going back to progesterone modulating anxiety, you can understand that association with that progesterone dropping off. So progestation, helps maintain the pregnancy. Why in the world would we want to give that to a male? Well, it's because men make that too, and those levels can be diminished over time. Has several roles in men. With men, it helps balance estrogen. It protects male reproductive tissues from estrogen and the adverse effects of excessive estrogen as men accumulate visceral fat. So the more fat you have, the more likely you are to make estrogen. Men, the beer belly concept. So that's where body composition with estrogen and progesterone, there's a big role there. So the progesterone opposes the estrogen-driven fat accumulation, with the central beer belly fat concept, and can make weight loss easier with combining with diet and exercise. For men, progesterone has neurological and mood benefits. It calms the brain, helps with anxiety and sleep, and it is neuroprotective. This is true for both sexes. It's been seen as a natural antidiuretic and antidepressant, a supporter of thyroid function. That's a big deal here because that plays, that's the connection, another connection with weight gain, particularly men and women as they age. And very typical, what happens when a woman goes through menopause? They gain weight, and it drives them crazy. They may be eating the same things, but they have weight gain in various locations. So the progesterone helps with blood sugar regulation, energy, libido, stamina, and utilizing fat. So all of these hormones play a big role, and so DHEA, if you've got low DHEA, you're going to have all kinds of hormone symptoms. With men, pregnenolone, pretty attractive, I guess, for men from the aspects of cognitive complaints, chronic stress, and suspected adrenal dysfunction, which has to do with energy. Progesterone, as we mentioned, helps balance out the estrogen levels. So, all of these things can be important. With women, progesterone is a core hormone supporting sleep, mood, cycle regulation, counterbalancing estrogen. Pregnenolone, once again, cognitive support, brain resilience, stress modification. And then DHEA, libido, energy. So all of these hormones are beneficial. They're certainly beneficial for people on statins, particularly pregnenolone, as I mentioned before. And we get into, well, what's the age cutoff? Well, there's really no biological reason to stop hormone replacement just because you hit a certain age. There is that concept of after you natural aging is, hormone decline. And that could be an argument. And, if you want to go down that path, that's okay too. But I like the concept of the natural side of things, but also like the concept of being able to have good health, be functional, being active, and maintain good body composition. So there's a lot of key components here. Of course, oversupplementation could be a problem. So staying within recommended dosage ranges are very important. Stay tuned for more health talk. We're going to continue to talk about this with the progesterone and thyroid aspect. Stay tuned. Welcome back to Health Talk. This is Fred Lowry of Lowry Drug on Hartness Road in Statesville. We were established in 1959. We're a traditional family pharmacy with a state-of-the-art compounding laboratory. Offer a full line of medical equipment, supplies, including CPAP, scooters, lift chairs, oxygen, and more. We have a very full line of supplements, nutritional herbs, essential oils, homeopathics, and more. I think you'll be very surprised. We are not your typical pharmacy. So we're talking about hormone replacement and optimizing your health span, the healthy part of your life. So how does progesterone support thyroid function? So your thyroid gland in your neck, that's your metabolic gas pedal, if you will. It has a big influence on body composition and metabolism. So keeping in mind, all of these hormone systems are fully integrated. The sex hormones, the thyroid, neurotransmitters that are chemicals that work in brain tissue, or at least that's the way we view it now. So progesterone appears to support thyroid function mainly by improving the availability of thyroid hormones and counterbalancing estrogen. So estrogen has a tendency to lock up thyroid hormones. And so here we have a situation where if a woman goes on oral estrogen, this happened more commonly years ago. It's not done much anymore, but the oral estrogen actually raised this binding protein that in the body that binds up thyroid. So that made thyroid less effective, and women gained weight. So they were relieving a hot flash, night sweats symptom, but then the side effect of that was weight gain. So this binding globulin, the thyroid binding globulin, the things that actually controls the amount of circulating thyroid hormone, gets bound up, and so what this means is you can have labs that read normal, the T4, T3 lab, but you still have thyroid-like symptoms. And sometimes supplementation with progesterone can reduce this binding globulin, making thyroid more available to work in the body. So progesterone therapy can increase circulating thyroid levels. In pregnancy, where progesterone is higher, it's been associated with higher levels of thyroid, which is kind of interesting. in terms of the metabolism and the growth of the fetus, but it helps maintain adequate thyroid hormone for both mom and the fetus. So it's a very interesting thing. Progesterone can directly upregulate the expression of genes involved in thyroid hormone synthesis, making of thyroid. It has a big impact on the overall thyroid system, and also by suppressing cortisol, stress hormones. It helps thyroid function. So keep in mind, when you're under stress, your body is in a conservation mode. We're going to conserve energy. Conserve, and the conservation means you're going to gain weight. And the other side of that is when you're under stress, sex hormones diminish. The tiger's about to eat you. You're not really interested in reproduction at that time. So those hormones diminish because there's a greater need for those stress hormones. So progesterone helps balance out all of that, reducing the estrogen inhibition on thyroid and cortisol inhibition on thyroid. So when we put all that together, progesterone does support thyroid function and helps modulate, the thyroid hormones that are out there. So now, if we can look at the context, particularly with women at different life stages. So we have women that are still cycling, maybe women that are pregnant, women in perimenopause and the transition, pardon me, and then menopause itself. So earlier I said in the first 2 weeks of your cycle, progesterone's low, is more estrogen there. You ovulate in the middle of the month, the progesterone comes on board, and that's in the second 2 weeks of the cycle. Interestingly enough, that part of the cycle has been associated with higher hormone levels as well. Pardon me again. So, in pregnancy, basically, progesterone supports pregnancy. It keeps you from losing the baby. Postpartum, progesterone drops, and so now you become more estrogen dominant, more fatigue, more mood changes for some individuals. Perimenopause, the transition with women from cycling to not cycling, to being able to reproduce versus not being able to reproduce. Perimenopause, progesterone is the first hormone to decline in that area. And so basically you have low progesterone, relatively high estrogen, and so all your symptoms become worse. Your thyroid, your weight gain, your other symptoms. And so there's this shift, and I want to go back just a minute to a woman that is still cycling, because a lot of the hormone symptoms that cycling women have when they're young are always in the last 2 weeks of the cycle. And so with that in mind, that's a low progesterone state, and many of these symptoms, PMS, overgrowth of the tissue in the uterus, etc., mood symptoms, can all be alleviated mostly by using progesterone the last 2 weeks of that cycle. So then we get into menopause. Progesterone drops very low. You've got thyroid things going on. And this is where most women look at hormone replacement, really. And so that's that is a time that that becomes more important, but it may be something to be monitoring and processing quite a bit earlier than that in terms of aging and maintaining that you basically have enough hormone material to be able to fill each of those hormone buckets subsequently. So something to keep in mind. Now, the last topic, when we come back, we're going to talk a little bit about microplastics and how that influences many things. It could be a whole topic of discussion, really, for this show. But microplastics do have endocrine disruptive characteristics. And so it's a big deal because seemingly microplastics also have more of an affinity for your brain than any other tissue. Stay tuned for more health talk. This is Fred Lowry.
Now I want to understand.
Welcome back to Health Talk. So we're talking about hormone replacement and optimal health span, if you will. One of the big topics of the day, or at least in the healthcare world, is microplastics. And one of the there's a lot of material I have to cover here, but microplastics are more associated with brain-related things and plaque formation for cardiovascular risk. So this is a big deal. And the one thing I want you to remember, too, is one of the biggest interventions for microplastics is prevention of ingesting them. That's probably one of the big ways that we get microplastics, either in water or in the foods that we consume. And all your bottled water is a big issue. The quality of the water you drink, municipal water, has a lot of problems. Everyone should be using a filtering system. I've mentioned those before in the program. But one of the things that I continue to see, and it drives me crazy, is people that are still microwaving their food in plastic. I just want to go, have you lost your mind? That information has been out there for so long. And if people still do it because it's convenient, and you're putting those plasticizers in your food, you're nuking the plastic into your food. It's about the worst thing you can do. The bottled water is secondary compared to that. It's just amazing to me that people still do that. And on top of that, you shouldn't be cooking with a microwave anyway. It changes the molecular structure of anything it touches. That's an appliance that needs to go on the curb. Get rid of it. You remember the original one's called a radar range. Cook naturally, cook on direct heat. Get rid of that thing. Microplastics. So right now, as we speak, there are shards of microplastic likely locked in your brain tissue and in your arteries and every organ. There was a research report in Brain Health. And by the way, I meant to mention this little piece is that I'm talking about now was reported in Mercola in Brain Health that human tissue contains far higher microplastic concentrations than liver or kidney or any other tissue. So at the same time, you think about your brain that controls your thoughts, your memories, your emotions, your moment to moment experiences of the day. And stroke is a second leading cause of death in the world. And so all of this, these plastics do contribute to that. And most of this exposure comes from ultra-processed foods, bottled water, food packaging, some airborne particles. It's a big deal. Researchers have pulled plastic particles out of diseased artery walls and stroke-related blood clots. These are really small fragments. You think about a microplastic fragment being the size of a grain of sand, then a nanoplastic would be smaller than a speck of dust floating in the air. And it's small enough to get between cells. So the brain health perspective, brain tissue carries microplastic concentrations 7 to 30 times higher than the liver or the kidney tissue. Now keep in mind, those are the organs that help you detoxify a lot of things. So this study highlights that human brain microplastic burdens actually rose 50% between 2016 and 2024. And donors diagnosed with dementia carried the heaviest burdens of microplastics. We don't really think about the things that we can't really see, but they are cumulatively having a big impact on you. So one of the things that they wrote about was that basically they're looking at this as a brain health emergency. And so here we have researchers have detected plastics and stroke-related materials. They found polyethylene, polystyrene, polyvinyl chloride. One study found microplastics present in 80% of blood clots, and higher plastic concentrations correlate with elevated blood markers for clotting, dangerous clotting activity. That's called a D-dimer level. So researchers reported 87% of tap water samples tested in 34 countries contained a lot of microplastics. There was a major study published in New England Journal of Medicine. 257 patients underwent surgical procedures to remove dangerous plaque buildup from neck arteries supplying blood to the brain. And the study found that they followed them for 34 months, found that the amount of microplastics and nanoplastic inside these correlated with higher stroke situations. So, bad thing now, the microplastics are also endocrine disruptors. Endocrine meaning hormone disruption. So now we have another aspect of maybe not just having enough hormone, but these endocrine disruptors can influence hormone secretion in a negative way. So these endocrine disruptors, these microplastics, disrupt by carrying hormone-active chemicals directly interfering with hormone production, hormone signaling, including sex hormones such as estrogen and testosterone. They can disrupt these hormone systems in several ways. The plastics have been shown to, the plastic particles have been shown to contain other endocrine disrupting chemicals because the chemicals have an affinity for that. They attach to that in food and water and environment, and then you get it through ingesting either the water or the food. So So once these chemicals are in the body, they mimic they mimic the hormones. They block hormone receptors, the places where hormones work. They interfere with that. They alter hormone production. They alter hormone breakdown, signaling. The signals become distorted. They can impair any organs that make hormones. They impair reproduction. They impair the thyroid. You can get a feel for how important this is, and so once again, the biggest way to deal with this is make sure you minimize what you're getting in. So the key hormones, all of them are impacted. So for both males and females, they can interfere with hormone production, interfere with egg development for women, sperm development in men. So this is kind of a basement level issue with subfertility or infertility, if you will. These things, another interesting aspect, they can cause feminization or masculinizing effects, altering puberty, menstrual cycles, development of sex characteristics. So, a lot of endocrine, there's a lot of research on endocrine disruptors relative to changes in sex and orientation and the way people experience that. Probably an unpopular view among some, but it is science. So this kind of gives you an overall overview of perhaps the issues related to microplastics and how they disrupt hormones in the body. So another thing to look at, to be aware of, and then I would go back to my original subject and topic, is don't think about hormones as being male or female. They are useful in both sexes and needed in both sexes. So something to maybe change the way you look at that, and also consider using some supplementation if your levels are lower. There are saliva testing available to see what's needed. Come see us at Lowry Drug in Statesville on Hartness Road. Thanks for listening.